Hi there, I am Amita from Nourish Doc, and we will be talking about a very interesting topic today: Chinese medicine and immune system. This is the topic that has become so popular. I mean, all of us need to strengthen our immune system. You know, we have all been locked up in our homes for the last 1 year now, and we want to learn how we can strengthen our immune system moving forward. So that's why today we have Dr. Eric Karkmer, who is an MD in Chinese medicine, also a PhD in Chinese medicine, and he will be joining me in hopefully in few minutes, so a few seconds actually rather than few minutes, to talk about how Chinese medicine can help strengthen the immune system. So that is the topic you're talking about. So any questions, any comments, any feedback you have, you are welcome to reach out to us and we will talk about that. Yes, MD in Chinese medicine, not MD in functional integrated medicine. We've been getting yeah, he's a real doctor in Chinese medicine. So when you make a comment called real doctor, there's a lot of doctors now, right? The doctor in Chinese medicine and PhD in Chinese medicine. That is his qualifications. And Dr. Eric is one of the top researchers in US right now in Chinese medicine. I just want you to be aware of that. And he is also writing a couple of books, and he's also formulator of Chinese formula. You know, he formulates all the Chinese formulas, and Chinese formula formulation is a little bit different. It's all personalized. You know, my Chinese formula would be different than your Chinese formula. That's kind of how it works in Chinese medicine. So Dr. Eric, well, thank you for your support. And Dr. Eric hopefully should be joining me in 1 second, and we can get the discussions going. Okay, so while we are not talking about GERD here, we are going to be talking about immune system. That is the topic of our discussion today. And let me just hang on 1 second, because I'm hoping that he can join me and we can talk about all the different things that, you know, on the research so let's see. He should be joining me in 1 second. Questions from Dr. Eric, but mainly immunity, guys. All of you need to understand how important our immune system is. Hello, Dr. Eric. How are you? Hi there. Yeah. Well, I can't hear you. I cannot hear you, Dr. Eric. All right. Okay. Okay. So, can you say something? I cannot hear you. So on the phone, something is wrong. Your speaker is not working. So yes, immunity is very, very important. So just hang on tight. You know, this is an amazing, amazing topic. I'll tell you, the immunity and the Chinese medicine. And Dr. Eric, you know, he has a very amazing, amazing story himself. He comes from a family of medical doctors, and he chose to become a MD in Chinese medicine. Dr. Eric, can you hear me?
I can hear you. Can you hear me?
Yes, yes, perfect,
Okay,
perfect.
great,
All right.
great, great.
Okay, someone was commenting you were covering the mic or something.
Probably, yeah. Okay.
Well, welcome,
Uh,
welcome, Dr. Eric. I'm super excited. I mean, I was looking at your personal story, and 30 years back, you come from a family of MDs, and you decide to go to Taiwan to become MD in Chinese medicine. Let's talk a little bit about your personal journey before we go into the questions.
Absolutely, that's true. There are a lot of doctors in the family. My father is a doctor. I have an uncle. Um, my sister, several, three brothers-in-laws actually are all doctors.
Oh my God.
So medicine is a common topic of discussion in our family. So absolutely. You know, and in truth, I had was kind of pre-med in college, and but lost a little bit of the drive and ended up traveling to China and spending a couple years in China and Taiwan teaching English, and that just took me down this other path, and ultimately led me to Chinese medicine. So back to medicine, but a different kind of medicine.
Fascinating. I think absolutely fascinating. And, Dr. Eric is one of the top researchers in the country in Chinese medicine. He's writing a couple of books right now. He's also a PhD, and he also teaches in one of the universities. So let's talk a little bit on the difference between the Chinese medicine from a point of assessment of the patient harmony. From a Chinese medicine, how does it differ from a conventional medicine?
Well, it differs tremendously. Um,
Yes, absolutely.
so I studied Chinese medicine in China, and one of the things you do in China is you really learn both medical systems. You're kind of required to learn Western medicine as well as Chinese medicine. And I think for many students, myself included, it's a very kind of confusing. It's a very confusing way to kind of learn medicine because you're learning these two really divergent ways of looking at the body. But in Western medicine, we focus very much on the lesion, or the agent of disease. What is the virus? Coronavirus, or what is the pathology? Where in the body is it happening? In Chinese medicine, fundamentally, you're don't think about those structures, whether anatomical or sort of microscopic. But you're really thinking about the body as a whole and in balance with the environment around you. So this idea, I think, of balance is a great way to think about it. But what is it that's sort of pushing the body out of balance, and what are the things you can do to bring it back in balance? And so that just leads you to a very different way of thinking about bodies and thinking about illness and how to deal with it. So the key kind of to me is in that distinction, and thinking about balance versus opposed to sort of like some ultimate cause.
Absolutely. So that's what brings us to this topic of immunity, right? Immunity has become such an important topic for all of us locked up, in our homes for the last 1 year now. And let's talk from a Chinese medicine perspective. From how can we boost our immune system using Chinese medicine specifically?
Well, great question. So first, we have to kind of back up and just think about what does even that term mean, immune system,
Yeah.
because it's a modern term. It's a term from Western medicine or modern medicine, and it doesn't exist in traditional Chinese medicine.
Wow.
So we have to kind of start there. What does exist though in Chinese medicine is a lot of ways to think about what we would call the immune system, and so in some sense you have a set of different approaches. One thing that Chinese medicine is very strong at, even though it doesn't maybe have this term immune system, is it's very strong at thinking about what you would broadly call sort of deficiencies, or maybe you might translate them as vacuities, but thinking about ways in which your body is somehow lacking or insufficient in some capacity. And so in a Chinese medicine, it's going to be things like, a qi depletion, or a blood depletion, or a yin or yang, or some sort of combination of things. And so it gives you, none of those translate exactly into an immune system issue, but they give you a whole different approach and a whole different way of thinking about them. And what's really important about that too, and I'm sitting in front of sort of my
Oh yeah, I can see that back there.
my cabinet of herbs behind me, is that you also have ways to think about the immune system. So you have ways to supplement those deficiencies. So you don't think about them directly as immune system, but you have ways to deal with the deficiencies, and that then ultimately is what kind of gets that immune system back in balance, or to give us that what we would call sort of a boost in immunity in Western medicine. Although even that expression is kind of a vague expression in Western medicine. What does that really mean in Western medicine? So Chinese medicine gives you like a different way of thinking about it, and then a whole set of tools for kind of getting you there. And again, it's really part of that bigger picture of like what is in balance and what is out of balance, and how do these depletions come about, and then how do you go about like restoring them if possible. So so it's very different way to think about it.
No, you're absolutely right. So let's think. So you talk about the Chi deficiency. I mean, I regularly go to the acupuncturist for different things, but the tools, like to a conventional medical doctor, or conventional medicine, I should say, that they'll do your blood test and they'll figure out, what the deficiencies are. And then according
Mm-hmm.
to that, they'll give you supplements or whatever. So then the Chinese medicine, like you said yourself, it's a little bit different, like Chi deficiency or blood deficiency or, so the tools are a little bit different. So how do we know? Where do we get started? Like as a, look at what has happened in United States, the number of deaths have been higher if you compare it to Asia. Like, so I come from India and China, the
Mm-hmm.
number of deaths haven't been that high if you think about the proportions. So what is it that I mean, not that I want to go in a discussion of what those countries are doing, but definitely, coming back to our immunity or whatever the convention word is, what are the tools as we in America can do to help strengthen, for lack of any other word, immunity or immune system, or not make sure that we don't have the deficiency, to your point, when Chi or blood or whatever the deficiency you're talking about?
Yeah. I mean, great question. And I think, to me, the first step is to start thinking differently.
Mm-hmm.
And I can just kind of give you an example from this morning. I was consulting with a patient,
Yeah.
and this is a very good example.
Mm-hmm.
So this is a patient that was diagnosed with COVID-19 several weeks ago. Um, have been struggling to get better, and we know that a lot of COVID-19 patients, of course, not everyone gets sick. That's one kind of immune system question there. And then some people get sick and end up getting very sick, and this idea of underlying deficiencies is often kind of at the root of it. This particular person, I think maybe from a Western medicine standpoint, would seem to be relatively young and healthy. She's a mom. She's got two beautiful twins. But from a Chinese medicine perspective, it's precisely the fact that she just had babies. I think the babies are about 9 months old or something like that. So we don't tend to think too, or we know it maybe in a vague way that for a woman to go through pregnancy, labor and delivery, nursing, and we know that it's hard on a woman's body, but we don't quite have that concept of thinking of a deficiency, if you will. So I was and as soon as I started talking to this patient about it, I was like, I've seen this. My wife has now had 3 kids. I've watched her kind of go through it, and I said, I can tell you, your body is depleted. We would call that a sort of a Chi and blood deficiency in Chinese medicine. And so I said, I think that's kind of the reason why you haven't gotten a pneumonia. So thank goodness you're not headed to the hospital, but you're still not recovering either. And I think this is sort of at the root of it, and that's what we kind of need to deal with. So I think first step is sort of like understanding the problem, and then the second step and then the next step is that how do you deal with it? And so in her case, I was kind of prescribing some herbal remedies to help with that. But it kind of starts, I think, to me, just being able to kind of think a little bit differently, and think a little bit more holistically about our bodies. I have to admit, having watched my wife kind of have 3 kids, I kind of, very intimately saw that it was hard, obviously, on her, and much harder on her than on me. Even though I was exhausted, getting up with kids and things like that too. But it wasn't until a few years down the line where I was like trying to treat her for her insomnia that sort of lingered. You never get to sleep when you have kids, and that I saw how fundamentally how much more profound it was than I realized. So I think there's a lot of that's just one example, but I can give you sort of countless examples of we're not always so aware of how life changes sometimes, or just how profoundly they can affect our bodies, and what are some of the things we need to do to address them. And to kind of get back to your original question, I don't know if we can credit decreased mortality rates in China and India to this, but I suspect that in Asia, broadly speaking, there's kind of a greater sensitivity to kind of like that kind of like just care for the body, and not that everyone does it perfectly, they don't, but being a little bit more attentive to some of the things you need to do, whether it's in terms of a diet or just personal care that probably help you a little bit. And sometimes those little differences end up having big effects.
No, absolutely. And it's like, I think fundamentally we have to shift here in America to think about our body as a holistic system rather than compartmentalized systems. Oh my God,
Yes.
water is not working. Oh my, this is not working. That is not working. So that's kind of how we think here. That one little thing is out, and then that if we fix that, but that doesn't happen. Um,
Uh, yeah, absolutely. So we have, I mean, medicine is very compartmentalized, and modern medicine is, and so it's hard for specialists to think across, outside their specialization. And another example, I'm just thinking of a current patient. This isn't exactly immune system deficiency, but this is an immune system issue. I've been treating a patient with like very stubborn eczema, but it's an immune system response. And we had to kind of go back and kind of like start thinking, like looking at her medical history, and turns out she has celiac disease, and kind of putting that all together, we were able to say, that's probably the root of it. And she was able to kind of like keep her eczema at bay with some pretty heavy dose immunosuppressant drugs, but that's not a long-term solution. I think Chinese medicine and other traditional medical systems, take you down a path of trying to think more holistically about our bodies, seeing the connections between skin and gut, or gut and brain, or what have you, as well as the connections with the environment. And that's just, it's extremely important. And I think it's going to be a process that's going to be something gradually we'll see ourselves shifting towards, hopefully, in this country.
Yeah, absolutely. So to all our viewers, we're talking about thinking of your bodies as a holistic, right? Not compartmentalized. And that's what Dr. Eric is talking about, is think of your health as a holistic health, all the way from the top to the bottom. Don't think of it like as something compartmentalized. So going to the other one, so maybe you can help us a little bit. I know you are a formulator for a Chinese herb company as well. And so let's talk a little bit to help the viewers from the Chinese herbs, or anything that we can do on a daily basis, whether we, I know the formulas are very personalized. So maybe you can tell us a little bit about the Chinese formulas or the herbs, immune system, something that an average person can do, maybe at home, or maybe get it from the supermarket. So what are your thoughts on that?
Yes, a great question. And so I do have a small herbal medicine company called Dow Labs, and part of our mission has been, I think, exactly what we're talking about here today, which is how do we take something that feels very foreign and esoteric and exotic, and make it a little bit more approachable, a little bit more digestible, excuse the pun, for American consumers. And so we think of a lot of it as kind of changing the conversation, if you will, and or giving us a new language for that conversation. Some of the there are a number of things I think I would encourage people to think about. We have products like this available at Dow Labs, but I think thinking about digestive health is extremely important, and we have a number of products that deal with that, and that's like so fundamental to so many issues. So I think that's one place to go. We actually sell a product called Immunity Support, which is just based on most of these are based on classic formulas, and that's a classic formula in Chinese medicine to deal with colds that are brought on by like a Chi deficiency or exacerbated by one. So the fact that our sort of defenses are down can make us more vulnerable to getting sick, and we probably all have the experience of seeing some of us, either us or watching friends get sick all the time in a flu season, while other people seem to like never get sick, and that difference is the difference of often of a Chi deficiency. So there's products like that. We have a few gynecological products too. I think for women's health is kind of a special, very interesting topic in Chinese medicine there, and it's just that physiologically, it's women have to deal with a lot of challenges that are complex and can ultimately lead to its own specific sorts of deficiencies and things like that too. For those of you interested too, it's not always so easy to find, but I try to write a lot of blog pieces too, where I try to explain how some of the formulas work in kind of a layperson's language, and I definitely encourage all of you to check it out. I think it's hopefully I've done my job, and it's easy to follow.
Yeah, no. So let's take one example for this session today, and let's take an example of telling your viewers in a very simple language on two or three herbs, right?
Mm.
That would make up a formula of an immune. The topic is immune system today, so we want
Yeah,
to focus on the immunity and the immune system, and the women part. I think that would be a separate topic. It's an amazing
sure.
topic. We'd love
Yeah.
to talk about it some other time. But so
Uh,
just tell our viewers in a very simple way, simple herbs that can help.
well, yeah. Let me talk about our product immunity support. This is called known as jade windscreen in Chinese. Yuping Fengsan is the Chinese name.
Mm-hmm.
Um, and it's made up of three. It's made up of three herbs, and they work together in a very interesting way. So one of them, some of your viewers may have heard, is called Astragalus. That's the sort of thing you can find in a health food store sometimes, maybe as a tincture. Um, that's a great chi supplement, and it also has the effect of kind of like supplementing the exterior. It kind of goes to the exterior of the body, so it builds up these sort of defenses. It's got another herb in there, which is called Atragalus and Baiju in Chinese, and your
Mm-hmm.
viewers may be less familiar with that. But that's also a chi supplementing formula that also sort of helps support digestion, and that goes more to the interior of the body.
Mm-hmm.
And then it has one other herb called Sapochnikova or Fang Fang in Chinese medicine, and
Mm-hmm.
that's an herb that disperses wind, and so colds and what have you, flu, COVID-19, those are all those sort of illnesses are thought to be brought by winds, and so you want a little something to sort of drive the winds out, and then two other herbs that help kind of supplement both exterior and interior of the body at that level of the chi, if you will. And so those are a couple of very basic herbs and Chinese. A very simple formula, but
Yeah.
extremely effective. And I've seen it sort of transform. I've had patients who kind of go from getting sick, 5 or 6 times in a winter, and sick for a week or two and pretty miserable each time, to like, you know, either getting sick once or not at all in a winter, and that's
Oh, wow.
pretty common. Yeah. So that's the sort of thing for people who are a little bit older who can stay on that. They can stay on that for a few months, and often people just tell you they just feel better on it. It's because we haven't quite noticed that we've been run down, that we're deficient, and so once you're on it, you just have a little bit more of a pep in your step, um, and that can kind of work wonders for, like, as an immune system boost.
Oh, okay. So the question is, I think those herbs what you talk about, not that all of us understand all the herbs you talk
Yeah,
about.
yeah, yeah.
It's very difficult.
Good. They're a little bit similar to, a more common one would be ginseng. Ginseng is probably something that
Okay.
everyone's heard of. So
Mm-hmm.
ginseng is in that same family as astragalus and atractylodes. They're all in
Mm-hmm.
those that sort of chi supplementing category. And ginseng would also be another great something you could also do on your own too, and get some of the same results. There's two main types of ginseng. There's sort of Korean ginseng, which is considered a little bit more warming. And
Mm-hmm.
sometimes to take that long term, it might be a little bit too much for your body, because the warming effects may lead to some side effects. But then there's also American ginseng, which is produced where I am in the mountains of North Carolina and the Appalachians and things like that. And that's not quite so warming, and that's something you can take for over a more sustained period of time. So those herbs are kind of all in similar categories and do some similar things, but they do kind of get to help address these fundamental imbalances in the body.
So ginseng in the I think ginseng, everybody's heard of ginseng. So
Yes,
that's
yep.
the critical ingredient, one of the key ingredients I should talk about, right? Emphasizing for the immune system, the way we're talking about.
I think, yes, it would be, so that can have really powerful effects. Absolutely.
Mhm.
Yeah.
Okay.
Yeah.
So in addition to the herbs, like Ayurveda, for example, and Ayurveda and acupuncture are very similar. If I look at it, they have the therapies, like acupuncture has the therapies of, needles, acupuncture therapy, moxibustion, cupping, and then supplementing with the herbs, and then the Tai Chi. These are on a higher level, like the traditional Chinese medicine. In addition to the herbs, your PhD, so much research that you've done, do you also recommend doing other things, like for instance, going for an regular acupuncture sessions, or some doing Tai Chi, or supplementing with the herbs some other things as well to help the immune system, or let the Chi deficiencies, I would say that, overcome that.
Yeah, absolutely. All those things make a difference. Personally, I'm a big fan of yoga, so I try to
Okay.
practice. I try to practice yoga 3, 4, 5 times a week if I can.
Yeah.
I found that so tremendously helpful. But I've also done a lot of Pilates. I mean, I think the thing, and sometimes it's just a matter of finding. But I do think exercise in different forms is wonderful. So finding the one that kind of works with your interest and lifestyle is that's great. Diet is extremely important. Um, Acupuncture and massage can be incredibly useful, and of course, those are some of that depends on the skill of the obviously the practitioner. But I've
That's
definitely had people in the past come to me. Just once a week for acupuncture. I'm like, you're not very sick, and they're like, I know, just I don't want to get sick, so that's why I'm coming to you. So if you can afford, and if you can afford to do that, I think that can be that can be wonderful. But I would really, barring that, which is, I know that's expense. Not everyone wants to go there. I think there are, really kind of looking at the diet, and that could be a whole another discussion about how you think about diet in Chinese medicine and probably in Ayurvedic medicine. There might be some really interesting overlaps there too. But diet and exercise, I think those are key. Sleep, often we either don't give it enough attention, or a lot of us struggle with sleep, and that's not quite a topic. That's not quite an immune deficiency
mm-hmm.
problem, but in Chinese medicine, it's not that far apart either.
Mm-hmm.
If you're struggling with sleep, you've got certain kinds of deficiencies that are going to also manifest maybe as immune system issues as well. Thinking holistically about all that, I think is extremely important. So don't I think one thing I would to say is we have a tendency to maybe be a little bit too adaptable. Sometimes saying, "Oh, that's just the way I am. I'm not. I have asthma. That's it. There's nothing I can
Yeah.
do about it." That's not true. I'm just a poor sleeper. I have a tendency to get sick all the time. I'd say don't fight back a little bit. There's more you can do than you might realize. And so and then figuring that out is maybe that you do need the acupuncturist to help you kind of get you on the path that you need as an individual. But there's so much you can do to that's
All right. Okay. I think we lost you for a six little second there, but
yes, I can see I'm getting low on power,
okay.
and
All right. So
I need to go find a charger, or
no,
are we?
that's okay. I think we can wrap up, and we'd love to have you come back on a completely different topic. But the message today, I just want to emphasize, and please help with the closing comments as well, is that really think of your body as a holistic body, and Chinese herbs. We talk about Chinese medicine today, and Chinese herbs have a powerful. They can help depending on, of course, your body type. We're not. This is not a medical advice here. These are just general educational sessions that some of these herbs can help you build, strengthen your immune system. So learn about it. That's what my message would be, to learn about it, and don't just take anything by yourself. Just seek out a practitioner or help with an acupuncturist who can help you with the Chinese medicine herbs. So if you don't know what to do, and your last comments or closing comments from you, Dr. Eric.
Yes, I agree 100%. Do seek out some help, and I would say the thing and people I think also don't quite understand how to appreciate the herbs maybe because
Yes.
they don't quite work like a lot of our medicine, like a migraine medicine or whatever. They really try to, when taken correctly, they really get at the root of the problem, and they really sort of can drive like these constitutional shifts in your body. So that's why it can be so powerful to think about like a immune system deficiencies or issues that way, because you can correct them as opposed to saying that's just the way I am. Chinese herbs are always given in combination. We talked about that small little combination with all these herbs that most of you hadn't heard about. But herbs kind of are given a combination. I think there's something kind of magical about the combination that helps, and it is the whole plant too. So
Yeah.
it can help push our bodies in these different directions. So there's tremendous possibilities out there. It's so underappreciated what can be done with it. And so I just want to urge everyone, seek out your practitioners, start to explore it, learn what you can do, and start to think about your body as a whole. And I think you'll be amazed at what becomes possible.
And then Chinese herbs, some of them are safe to, Dr. Eric has a company, they formulate the Chinese formulas, those are fine too. We have a few questions that are coming up, and these are personal questions. I'm sorry. I really appreciate your engagement, all the users' engagement, but we cannot answer personal questions. This is more like an educational session. I know someone's asking about blood pressure and someone's asking about immunity support, cold, and allergy. So I'm really sorry that we cannot discuss the personal questions here. This is just an educational session. With that, I'd like to thank Dr. Eric for being here. To all the viewers, I hope you understood a little teeny bit about Chinese herbs and how it can help your immune system. So let us know if there are any questions, any feedback. We are here for you every single day, just spreading the awareness of holistic medicine. With that, thank you so much, Dr. Eric, for being with us.
Thank you so much for having me. This has been a pleasure.
Absolutely. Same here. With that, thank you so much. Bye-bye.
Thank you so much. Bye-bye.